Gang is here, all of it. Jamila is back and the social distancing is just right. On the show tonight, yes, social distancing, quarantine, self-isolation, and the biggest hand-washing party the country has ever seen. Did it have to take a tiny virus? Also on the show tonight, no more mortuaries in Kakamega. Is the governor dead right or what? And Nairobi's new governor general, the sanitizer that City Hall needed. We'll also check if Governor Sonko is being isolated. Plus, the kicker, the punchline, the take, the memo, and the angle. Let's begin tonight with that dramatic announcement that was made by President Uhuru Kenyatta that set off a raft of measures that have changed Kenya, perhaps forever.
As you may recall, when we first announced the confirmation of the first case, we did state that we had traced 27 persons who had come into contact with the first patient. We have since tested all 27 people at our National Influenza Center. And today, we have received confirmation of 2 more cases of the coronavirus.
All right, that announcement by President Kenyatta on Sunday, right? Yeah. Setting off quite a number of measures that I think we're still feeling the impact of right now. And Linus, a very dramatic turn of events for a very long time. I mean, we sat here, we talked about coronavirus, but we were talking about it in the context of the world. It was out there. It was in Wuhan. We were calling it ground zero. It was in Italy, and it was in all these other countries. And now it is here. Our schools are closed. There are all these other rules, and people are washing their hands.
Joe, it felt like a distant possibility, and that is the mentality with which the Kenyan government approached this. Let us not forget the day that 239 passengers landed at the Jomo Kenyatta International Airport. Let us remember the gentleman who took that photo and posted and what happened to him. Because at the time, there was this mentality that sort of said, it's too far from us. And I see it not just with the coronavirus, we saw it in Ebola. And remember, Ebola struck as close as Uganda, yes, Gulu, and all it takes is one person to cross the border with the virus, and you have it. And Joe, you look at how it has actually spread. It has exactly the same characteristics as previous outbreaks, the worst of which was the 1918 Spanish flu. There is the element that acts as the force of dispersing or spreading the disease, and that is the mere step of humans traveling. If you look at the 1918 Spanish influenza, how it spread, the first places it was hitting were the ports. Look, many years, 102 years later, and you will hear the Princess Diamond ship off the coast of Japan has people who are carrying the virus. Travel is the main mode of transmission of this virus.
And it doesn't help that now travel around the world is very easy, explaining why, for example, Europe has been that badly hit because it's so easy to travel around the different countries. Very, very easy.
Yet you will be surprised that governments chose to tackle travel last, not first, which is very, very interesting. What if these travelers never moved from the places they were in the first place? Probably Kenya will be free of COVID-19.
Yeah, that is true. I mean, that in fact, if you listen to what CS Mutahi Kagwe said yesterday, is that of all the 7 that we have been talking about, the origin is actually Kenyans who are traveling home, or some, in the case of that, Burundian, but there were people who were not originally here. They came from somewhere. They got the virus wherever they were, and then they came into Kenya. So we are still at that stage of the imported transmission, Jamila.
And actually, Joe, I think that is a good stage to be at, the imported transmission, rather than what they're calling community transmission, which would be the worst case scenario,
Yes,
where wenyewe kwa wenyewe tunaambukizana, because as it stands now, imetoka nje. And if we get to that point where it's a community transmission, where we are living together, tunasambaziana, us who are here, those who have not come from anywhere else, that would be now where we should start getting worried. But I think that's why some of the measures that are being put in place by the government is to prevent us to get to that point where sisi wenyewe tunasambaziana. Now we are seeing washing hands, we're seeing limiting movement, and of course what has been said, social distancing, watu wakae mbali from each other, which is very, very important. But you spoke about the West and how they dealt with travel last, considering how easy it is to move around in those countries. The train systems work, the road networks are amazing. People can get from one corner of the country to the other pretty quickly. But then you look at countries now that were able to control it, and everyone keeps giving the example of Singapore, and it's because when it happened in China in December, they quickly put measures in place to try and stop the spread of this disease. Because remember, Singapore and some countries in that region had gone through the SARS pandemic, where they also lost a lot of people. So the healthcare system was actually ready to deal with it, and they dealt with it immediately. Now we are seeing the West, now the European countries struggling now because they picked it up later, almost sometime in January. That's why we're seeing it now. It has become now the center of the pandemic is now Europe, no longer China, which today actually announced that it does not have any new infections as of today. So I think for us as Kenya, we are putting in efforts.
In Wuhan, actually.
In Wuhan, yes.
They had Xi Jinping actually walking around in a hospital in Wuhan without a mask, just to say,
new infections that we are doing okay. And as Kenya, I think today we had some good news from Waziri Mutahi Kagwe that the 8 people who were tested actually were negative. So leo press conference yake alitangaza hakuna mtu anaye new infection. We can actually listen to that soundbite from today's news conference. Mutahi Kagwe announcing what he called good news for the first time since they started.
In the last 24 hours, we have screened and tested another 8 cases, all of which have turned out negative and are being processed as we speak to be discharged to go home.
So Yvonne, what you could say a glimmer of good news in what, quite frankly, has been a depressing period and continues to be for many Kenyans, quite frankly, but a very authoritative communicator of this thing, we must say, of Mutahi Kagwe.
He couldn't have come at a better time in this country. From what we have seen so far, his communication is authoritative. He's a credible figure. So when he comes on, we know he's about to say something that you can serious believe. That you can believe. I was trying to find that one, and I thought that was a really good thing today about saying, okay, so you know what, not every time you see me I'm going to say something negative. In fact, was it just yesterday when the president was talking about the handover of Nairobi, and we get the alerts here that the president is about to and I thought, oh my goodness, if the president is coming, this must be big. This must be 10 cases. I mean, this is it. And then it turned out it wasn't.
Upside down.
And upside down, isn't it? Never have I been so happy. And we will talk about this, I know, afterwards, to hear about, okay, so it's about Nairobi handover, thank goodness. So this news today was good. I want to talk a little bit, though, about the communication. So we've said that he's authoritative. I think, though, the government needs to do more in terms of targeted messaging and making sure that it is on time. For a lot of people who are on WhatsApp, I'm sure they've heard of, the WhatsApp service that South Africa has provided. In fact, I am on it myself. And you type in all of this. And you get, timely information that is up to date. Like we have said before.
And you just need to do an emoji.
An emoji. You just put in the thumbs up sign, and that's what? Prevention. That's if you want information on prevention.
Like literally within that second.
So a number of things that I think need to just work better for them. That SMS service, I think all of us have received a total of 2 or 3 messages considering today. But what is important is the way in which they have been giving these press conferences. Can I also just say, now that we're speaking about communications, that not all of this information has to be a press conference. I mean, we saw earlier today, the Matatu sector, I think they were addressing issues there. That was PS who? Hinga?
Hinga,
yes.
Hinga.
And he was flanked by a number of people behind him. There was no social distancing.
Yeah. He spoke about social distancing.
And he spoke about social distancing. The
him.
irony was that there was all of these people behind him. So I think, just some of this needs to be done better. I mean, I know the churches are also giving their statements. Some of these are just press statements. Like, let's just put it out there. I think the only person we need to hear from now, CS, and anyone from his task force or the president. I just wanted to add something about this thing now that it's, hitting Africa, is the one thing it has shown is how economically isolated Africa is from the rest of the world. Mm-hmm. We're getting it last, and that's because, and that shows you, we don't have as much travel between Africa and China and Africa and Europe as we thought we did.
And Africa and
Africa and within Africa. I mean, how many stories have been done about just how difficult it is to travel within the African continent? Moving from here to Senegal, for example, is one. The hurdles of, the visas, one. The cost is another thing. So maybe that might work in our favor, but I don't want to be hopeful just yet, because this is just new.
Even from, traveling from here to Burundi, for example, I mean, it's probably 45 minutes, but it will cost you an arm and a leg. I mean, enough money to travel through 5 countries in Europe. But the other thing about that is that there are many people right now who are saying, well, we don't know what this means for Africa, because this is a place which has a very different context. For example, you have the slums that are inhabited by a lot of people who, to whom this whole social distancing thing couldn't have been more bizarre. Because how do you?
Impossible.
So it is impossible. If you look at how people live in some of the informal settlements here, and I was reading some things, and they were saying that even for the WHO, this is going to be a learning experience, because they don't know how the virus would behave in the context of the populations that we are dealing with. So it's likely to be a very interesting thing. The other thing that they talked about, this whole thing of testing, and we're going to talk about that a little bit, where they were saying they're not too sure about the kind of testing that's happening in African countries, that it's perhaps not robust enough, which means that there might be people out there who suffer from this thing and nobody really knows. But the flip side is, maybe they might suffer like that quietly somewhere, and nobody will ever know they actually suffered from it. So there are things that they don't even know about how this thing is going to behave among the African populations, with all the inadequacies we may have and the different contexts. Francis?
But, before that, I refuse to be very excited about the press statement today by the CS Health. Why? Because I think this is the ultimate test of our systems. That there were no new reported confirmed cases today.
In the last 24 hours.
In the last 24 hours is not very good news, so to say, maybe for now, but maybe a lull before the storm.
Right now, people want to, even if it's 1 second.
Even a sliver.
1 second
but you see, but you see, this is, as I said, the ultimate test of our systems. What we are dealing with are years of neglect of our health system. God forbid if this thing blows up completely like it has done in some European countries. I think it is an opportunity maybe for our government now and in the future to remember to invest effectively and prudently in a healthcare system that works for all.
Can we listen to the WHO statement? The Director General was actually talking about the quality of testing that goes on in Africa. Then we can delve deeper into that.
As of today, the number of cases reported from sub-Saharan Africa is 233 cases and 4 deaths. And it's actually, in terms of confirmed cases, it's the lowest region. But as Mike said, we cannot take this number as the amount of, or the number of cases we have in Africa. Probably we have undetected cases or unreported cases But in addition to that, even if we take these 233 cases are true, we have to prepare for the worst. In other countries, we have seen how the virus actually accelerates after a certain tipping point. So the best advice for Africa is to prepare for the worst and prepare today. It's actually better, if these numbers are really true, to cut it from the bud. And that's why we're saying we have to do the testing, we have to do the contact tracing, we have to do the isolation, and cut it from the bud.
But it is also good to acknowledge that even the so-called able people are also totally overwhelmed. All right? So let's not always believe in what somebody out there. They have got a very dismissive attitude about what we are able to do. So let's not look down upon ourselves. Let's behave. If we behave, we will prove them wrong.
You see, prepare for the worst today. Yes, at least something is happening, but there is need to do more. Yesterday, I attended a news conference by the Council of Governors. And I think that, in my mind, triggered the first point of concern, that they needed over 300,000 personal safety kits for their medical personnel. How many had they gotten by yesterday? 2,800.
Yeah.
Then,
and they need how many?
Over 300,000.
Less than 10% of what they
Less than 10%. Then, only one medical officer per county is being trained to go and train others. Those are 47. There is a concern there. Then, there are only 2 testing facilities in the country, and they are in Nairobi. There are no regional testing facilities. That explains why Dr. Adhanom Tedros is saying, prepare for the worst today. Not that we are praying for the worst to happen, but let us prepare for the worst now.
Yeah.
Something that I'm sorry, Linus.
Welcome back, Jamila.
Thank you.
Welcome back, Jamila.
Something Gachuri talks about preparedness, because that is the worry about us getting overwhelmed at some point if, God forbid, this goes to the worst, as you talk about, because you look at how even those developed countries in the West are struggling. For instance, something like a ventilator that is supposed to help someone breathe, because that's one of what happens when you get this virus. It affects your system that you're unable to breathe. A ventilator needs to have, there needs to be electricity all through. There needs to be a backup generator. It needs to have enough space. If something as that the US is grappling about getting enough of them for people who are already sick and need it, are going through that, I worry about how we will manage if, God forbid, we end up that. And the other thing is the ICU facilities. Do we have enough? How many do we even have in this country in case that people need them? So we need really to do our best to make sure that we don't get to that point where we get overwhelmed and really affects a huge population in this country. Because when you look at the numbers as they go up, I think in Italy over 400 people died in a single day. I think Italy is the world's 4th largest economy. Really, we need to be worried about where we are going in terms of how we are going to stop this from spreading further than it already has.
Which is why, Linus, for us, our best chance is really to make sure that this thing does not spread. It doesn't go beyond perhaps even where it is right now. And that brings to my mind Uganda. They have taken some drastic measures, even though not a single case has been reported in that country.
We needed to have taken those drastic steps the moment we learned it is spreading in China, especially in Wuhan city, because it's very simple to understand the modalities of this, and that's travel. If somebody leaves China or Wuhan to another city and then makes onward trip to Kenya, then we are there. And you see again, it had to come from other places, including Italy, including the UK. Our first case came from the United States. But Joe, I want to share the worries that Jamila is expressing here and say that no country, no matter powerful, no matter how wealthy, would be prepared to handle a virus or a pandemic of this kind. This is a massive challenge to humanity. And it brings me to some of the literature we've been going through, including the BBC Future series, that talk of end of civilizations. Civilizations can actually be ended by pandemics like this because they overwhelm systems. Italy is not a poor country, it's a first world country, it's supposed to be a first world country, but it is struggling. But have you just imagined if the spread of coronavirus in the scale that it is in Italy came to any African country? We simply don't have a capacity to handle that. We are talking of 11 beds. In Italy, 400 plus people are dying in 24 hours. That's really, really massive. But let's look at the challenges that are really making human existence quite risky. And this is one of them. One of them is pandemics. And there was a prediction that between 2040 and 2050, pollution will make the world a very, very difficult place to live. Has it even had to reach there? No, it hasn't. Think of the smog, the quality of air that industrialized nations are currently experiencing. Think of the depletion of resources that we have. Where will fresh water come from, for example, in 20 years, 20 years' time? So to me, I think coronavirus is a warning shot to humanity. And this is the worry. Two things that humanity has always pursued with a lot of vigor and energy. Power and money cannot stop some of these things when they start happening.
No, they can't, because you see, right now, people are all holed up together. I was watching something, and they were saying in the US, they couldn't have enough beds in certain, because there are, like, I think 3 states that are very badly hit, and they were saying about 50 counties in the whole country. And this is so interesting, because now they're even getting retired doctors and retired nurses that already they are beginning to feel the impact, even in terms of the number of doctors that they have, the number of medical personnel. And I mean, that country has a lot of people in the medical industry. And
the simple lesson, Joe, is humanity is vulnerable. We can't say just because we've overcome so many things, including achieving artificial intelligence, including having some of the world's most powerful nations. We do drones, we are advanced as a human race, but we are vulnerable. Coronavirus is saying it can end in a very, very short time.
I mean, I think for me, the solution is acting and acting fast and very quickly. You talked about testing. CS Mutahi Kagwe said today that over 600,000 people have been screened across all our entry points in the country. 173 have been tested with 7 confirmations. Now, testing is a big issue, even in the US, by the way. I mean, all you have to do is watch the US press and the US media, and many citizens are complaining about the lack of tests for people that feel like they actually need it. If you take a look at what's happening in the UK, said the same thing. She's been waiting 7 days, she's been in quarantine, and they're saying, we will get to you. But let's take a look at where it's working and how it is. And, LKO talked about money and power and how you use that. So this is what happened in South Korea, which is one of the countries that has been praised for this. So the minute, the spread began, and from China, and when they were able to identify at least the genetic code of the disease, what happened was private companies as well as government in South Korea quietly started stockpiling test kits. So they started putting this together because they knew it was coming. They knew exactly what was coming. And not to say that South Korea has not been hit, but even at their worst, South Korea has engaged in mass testing. And by the time things were bad, they're able to actually test up to 10,000 people per day. They have drive-through test centers. They have consultation phone booths in hospitals where you can just go in, talk about your symptoms. If you meet the case definition, as they call it, you are then, tested. And these are some of the things that they're able to do really quickly. And, testing is one of those for those that feel they need it, so that you identify who has it, you isolate them, and you begin treatment immediately. Another thing that is important for us to look at when it comes to just how fast we are able to respond to this is the self-quarantine and the social distancing. By the way, it is believed that the term social distancing, in fact, came from the South Korean president. He was the first one to actually start to talk about this. But this self-quarantining that we're talking about, and I'm glad CS Mutahi Kagwe said today that they will start to, enforce that and look into it. It is impossible to tell a human being self-quarantine. What does that mean? Spell it out. You go into your house and you don't see your neighbor. Even in your house, and we've talked about the difficulties in low-income areas, but even in your household, you do not meet any other individual. You are served food in a room by yourself. Take a look at what we heard happening in China, where you are signing documents, where you are getting a permit. Let's not let it get to the lockdown of Italy, where you literally need a permit to get out of your house. In fact, in South Korea, again, where they did well, they have a GPS-enabled app that monitors your movements. If you stray outside of your home, it triggers an alert, and they come to you and say, "Hey, you are going."
But the cultural differences are massive.
Are massive. That's right.
But you see, the important thing, we're in very extraordinary times. So it will require all of us
measures
to behave in an extraordinary manner. And that's why I agree 100% with what CS Mutahi Kagwe is saying. Behave at a personal level and collectively. I mean, look at how people are treating the coronavirus and its spread and everything else. Some people actually were initially thinking it was a joke. It was, some still do, some were even saying it was an attempt to stop what. People didn't take it very, very seriously. Now, when it is closer home, when it got home, that's when people start realizing, Allah, this thing is serious. And you can see, and it can tell by the kind of panic that you see all over. I mean, look at the number of people who are flocking supermarkets to panic buy.
Yes.
Look at the rising cost of sanitizers from as low as 200 shillings to 1,000 plus. That explains to you that people have started to realize that this thing is serious. However, there is need for personal behavior. I mean, the handshake wachana nayo, these hugs wachana nazo. These are times that we must behave the way we are supposed to behave.
I think it has to be acknowledged, quite frankly, that I mean, there was initially, I think we appeared quite clueless, but over the last week or so, I think there are things that have been done that perhaps eventually could be the game changers. For example, something like shutting down all schools, because that was going to be massively important in terms of spreading this thing. I mean, I was just imagining if you had, for example, one teacher come into a classroom, maybe from one yellow, whatever that thing is, and then opens the door and maybe got infected somewhere, and then all the kids in that class, maybe 40 of them, then they disperse into their dormitories, which are probably all over the school.
And imagine children and their hygiene habits.
At some point, when maybe two girls or boys start exhibiting some signs, you panic, close the school, and then all these kids now take it to every corner of the country. So I think that that decision to shut down schools was actually quite important. I think probably they should have gone further in terms of issuing directives, in terms of shutting other places. I recognize that where the economy is, there is hesitancy in banning this and the other thing, but I think at a certain point, it is better to sacrifice for this short period so that you secure the bigger picture.
The next point of contention.
Alongside that, Joe, of course, is the ban on foreign travel.
Yes,
for foreigners coming into Kenya. I just wish that came
a little bit earlier.
But the government should be commended for the steps that were announced on day one of the discovery that we have coronavirus
and going
cases.
Forward, what the updates they've been giving.
Because the right steps were taken on the first day. Not wait. I've seen the United Kingdom only shutting their schools tomorrow. And you can tell that there's been a lot of damage already by the time they're doing this. So it was timely that close down the schools, but also limit travel.
Interesting.
As we take a break, we need to remember that, Joe, again, I've been away, so niruhusiwe niongea wiki tatu, but just one line. We need to understand that we are still learning about this virus. It's just how many months since it was discovered? 4 months or so.
From December.
Yeah, from December. And there's still evolving. Things are being discovered every day about it, including the fact that now young people are actually getting infected and critical
really sick.
and getting really sick in the ICUs in France and Italy, contrary to what we had earlier in China, when younger people actually, I think over 0.2% of those who are infected were younger. It was affecting all people in their 60s and 70s and 80s. One, and two, about a vaccine, because people keep hoping, a vaccine itakuja lini. I think there was a statement I was watching on CNN before we came on, that maybe they'll start testing a vaccine in 1 year.
The White House Coronavirus Task Force.
In 12 months, they'll start testing for a vaccine, which means that they still worry period, mwaka moja mzima, before we're actually able to contain this thing. I think now we can take a break.
We will take...
Jamila has called it.